Hello everyone. Myself, Dr. Gireesh MS. I'm a professor and HOD at MS Ramaya Medical College and also a consultant nephrologist at Ramaya Hospitals, Bengaluru. Today we are going to discuss something which is very important when it comes to day-to-day activities also, and even when it comes to any general illness that we usually encounter. So that is pedal edema. What is pedal edema? Pedal edema is the scientific term for what we call as swelling. So swelling of legs, this is scientifically known as pedal edema. Now, once we know what is pedal edema, you know that this is not uncommon. So most of us would have encountered it at one point of time or the other in our lives. It is not just because pedal edema is there, okay, it is kidney disease, the kidney doctor is speaking. No. There can be many causes for pedal edema. It can range from kidney disease to heart disease to liver disease to just the blood being on the lower side, which is called as anemia. And there are like a poor oral intake, the hypoproteinemia, what we call that is less protein in the body. Apart from that, there are thyroid disorders. Then there are some medicines which themselves will cause pedal edema, that is the swelling of lower limbs. Likewise, if there is some injury, also there will be swelling. So those are like or transient or they are self-limiting. So once there is pedal edema or the swelling of the legs, then the next point will arise. So what is this pedal edema due to? Is it kidney disease or it is something else? So should I do something about it or should I neglect it? So for these questions, we will try to get some answers. And mostly, I'm going to talk more about the kidney disease because I am a nephrologist, and that is one of the most common causes for swelling of lower limbs. So this is what we are going to talk in the next 5 minutes or so. Now we understood what is pedal edema. We also covered what are the causes for swelling. Then why does this swelling happen? We need to understand this basic fact that swelling means increase in the water content in that part of the body. So, why is there water excess? That we will come back again. So, this excess of water that gets collected in one part will result in swelling. If there is an injury in any part, you will see the swelling there. So, that is because of all the water that collects there, because of the fluid, that is the water that leaks from the blood vessels. So, this is results in swelling. In kidney disease, there can be various causes for the swelling to happen. We understood again now that swelling is because of excess water. In dialysis, sorry, not in dialysis, just in kidney disease, why does this swelling happen? Let me just brief you a bit about the kidney function as such. Kidneys, everyone thinks the kidney function is throwing out the waste products, but it is not so. It is involved in management of the water balance of the body. So it is also involved in the apart from throwing out the waste products, it has to maintain the good products within the body. So that shouldn't, kidney is a filter. So it should filter in such a way that only the bad things go out, but the normal things they have to stay inside. So this is very important. But in some of the kidney problems, what can happen is protein can leak from the kidneys. That is not renal failure, but there is a one kind of injury wherein there is protein leak. This we call as nephrotic syndrome. This will result in less protein in the blood. So when there is less protein in the blood, this is the protein that holds water inside the blood. And once there is less protein in the blood, the same thing happens in liver disease because protein production is less over there. So this less protein is unable to hold water inside the blood vessels. So what happens is the blood, this leaks outside of the blood vessels. Now it can leak anywhere in the body. So why is it only pedal edema that we see more? That is because it is dependent on gravity. You understand that it is fluid. Fluid will accumulate wherever there is maximum amount of gravity effect. So if at all you are sleeping, sometimes you might even see swelling of the eyes, swelling around the eyes. Sometimes it can be seen in the back. But whenever we sit or stand for a long time, gravity is highest in the lower part, that is in the legs. That's why all the water will slowly go and collect there. This is the reason why many people will see that once they get up, there is no swelling. But as the day goes on, there is swelling or the pedal edema that appears. So this is the reason that water accumulates there. One of the causes is protein leak from the kidneys, which we call as nephrotic syndrome. Apart from that, So kidneys, I told you the functions is to regulate the water balance. So when the kidney failure ensues, so this water balance can't be maintained. Even though the kidney is secreting some amount of urine, it is insufficient to throw out that much of water as required. So what will happen? The water accumulates in the body. Here the protein level is normal, but there is increased water. And because of the increased water, there is increased pressure, and this increased pressure, what it will cause is again leakage of water outside of the blood vessels. So either this way or that way, ultimately it is the leakage of the water from the blood vessels which will result in accumulation of water in some of the tissues. And this tissue, which is the most dependent being the legs, so we will start seeing swelling in the legs. So this is how the swelling happens in cases of kidney failure. And just to make it clear that you don't miss something, it can be because of protein leak or it can be because of kidney failure itself. So both the things can lead to pedal edema or swelling of the lower limbs. And once there is swelling of the lower limbs, we know understand that there is a high possibility of kidney disease. And yes, we have to understand one more important factor here. When does this show? Kidneys have got all, in fact, for that matter, almost all the organs in the body. They have got great power. They will keep on going, doing their function till a large part of that organ gets destroyed. So even here in kidneys, until almost 70% of the kidneys are damaged. So till that time, or what is called as failure, till that time, usually the patient remains asymptomatic. That is, he will absolutely feel normal. He might not feel anything abnormal outside of his routine thing, but the damage would already have happened. So by the time that the swelling is seen, it is usually already pretty late in the field of kidney failure. So any symptoms that appears later on, which might include decreased food intake, sense of vomiting, not feeling well, and sometimes in the end stages and all that breathing difficulty, these all are much later. So, but usually the first symptom that is usually seen with kidney problem is swelling of the lower limbs. Along with that, usually there is also increase in the blood pressure. So these are the two important things that we have to look for. And hence, pedal edema is not to be neglected. And once pedal edema or swelling is there, we have to do a lot of tests. We have to do the examination of the patient to ascertain what is the cause of this swelling. And as I told you, some BP medicines themselves can cause swelling of the lower limbs. It is because of their side effect. So if that is so, just stopping the medicine will suffice. You need not do anything more. But if at all, especially when the patient is diabetic or hypertensive, we have to suspect that it can be a kidney problem that is causing this problem. And hence we have to do a lot of tests. Not lot of tests actually. So let me correct myself. It is not lot of tests. It is basically some simple test that needs to be done. One is the urine test. In the urine test, we will see whether there is protein leak or not. And then there is another one test which is usually done in the blood, which is a creatinine. So with these two simple tests, we will be able to know whether there is kidney damage or not. So this is the screening test. If these things come positive, then we go ahead and do more tests so that we will get to know what is the other causes are there or not, and for the kidney disease to happen, what is the actual cause. So this is what we will be doing if these two tests are positive. But these two tests are the first test that should be done to ascertain whether the kidney problem is there or not. If there is no kidney problem, then we do more tests to know what is the other causes, as I have already told in the initial part of this talk itself. So some tests, a physical examination to know where is the swelling, and a history of the medications that are taking or any other things that has gone wrong in the this one. You can see that many of the viral fevers also will cause swelling. So these are all called as reactive. They will usually disappear once the problem is calms down. So you need not worry if there is a swelling, but you need can't neglect if there is swelling. This is what I would like to emphasize. Till now, we have covered what is the swelling, why it happens, what happens in kidney disease, and of course, the most important factor that it is quite advanced disease if you are able to notice swelling, which is caused by kidney disease. Then, after talking all these things, most important is the treatment. What we need to do about this? We already understood that swelling is nothing but excess water. So most important thing is limiting the water intake. This is one more misconception usually in the population, that if at all there is a kidney problem, they should drink more water. That is not actually true. The actual water intake that is recommended for any healthy person is 1.5 to 2.5 liters per day. If there is a history of kidney stones, or if there is history of repeated infections in the body, especially urine infections, then we ask them to take about 3.5 to 4 liters of water per day. But this is most important. If there is swelling, it means there is already excess water in the body, and hence we will have to reduce the water intake. So we keep on advising the patients not to take more than 1.5 or 1 liter, depending upon how much is the swelling. We have to understand one more factor here, that excessive salt retains water inside the body. Therefore, it is important that we restrict both salt as well as water. By restricting these two, which are forms the most important basis of our treatment, and this itself might be sufficient to take care of the swelling in many of the patients. But in those patients in whom these two general measures are not sufficient, we use some medicines which will increase the urine flow. These are called as diuretics. So these diuretics, they throw out more water in the urine, so that the total water content of the body comes down, and hence the swelling also comes down. This is in general about swelling that we encounter not so uncommonly in our lives. And yes, please don't neglect if there is swelling, but need not fear if there is swelling. With this, I will just conclude my talk. Thank you all for watching.